Now I introduce you Dr. Romeo.
Good morning to everybody. It's a pleasure to meet you in this conference about the CTU Shockwave machine. And in my clinical practice, I use this device for many years. I'm experienced in the activity of shockwaves from up to 18 years. And I experienced the effect of all the kinds of devices in the market: electrohydraulic, radial, electromagnetic, piezoelectric devices. And I studied for many years, for many times, this machine. This is very different from other kind of machines, even if the CTU shockwaves starts its activity from the normal way to produce the characteristic of the shockwaves. And in this my presentation, I will explain you the concept of these machines that are quite different from the other machines, not in the way to generate the shockwaves, but the transformation of the original impulse in pure mechanical shockwaves. So I can start with my presentation. Okay. I am a specialist in orthopedics, and I work on the Galeazzi Orthopedic Institute in Milan, and my activities related to biophysical application of mechanical shock waves and pulsed electromagnetic fields in clinical and basic research. You know that shock waves is a change of the perturbation and the change of the atmospheric pressure due to the high intensity of mechanical movement of the air, as you can see in the normal explosion. And for therapeutic use, shock waves repeat this scheme of the great variation, rapid variation of the energy and then a negative phase. This is very characteristic, and these two effects, positive and negative effect on the surrounding pressure, are at the origin of the biological effect of shock waves. In particular, we have to consider the first part of the shock waves, the positive part that needs a low rise time, that is the time of the rise of the shock waves up to the maximum pressure, and then a progressive variation of the values of the pressure to negative phase. And the important aspect that distinguish the characteristic of the shock waves are the rise time, the peak pressure, and the negative phase ratio, the ratio between the positive and the negative part of the shock waves. All together, they give the biological effect of shock waves. This is why because cells are the ability to transform the mechanical impulse in biological effect that in the ultimate phase is a regenerative effect, and the modulation of the inflammation that is the main characteristic of a chronic disease in musculoskeletal conditions like in tendinopathies. All the machines in the market start from the same aspect, to have an energy storage that is a condenser. You can see here from for the piezoelectric, electrohydraulic, and electromagnetic device. And the diamagnetic device of CTU Shockwaves condenser as energy storage. The translation of the effect in piezoelectric is due to piezoelectric crystals, to expanding plasma in the electrohydraulic machines, and the magnetic coil in electromagnetic machines. The CTU shock waves is a part of the electromagnetic device due to the magnetic coil. The ability to focus the shock waves inside the tissues for piezoelectric machines due to a paraboloid surface, to an ellipsoid surface in the electrohydraulic and the paraboloid surface in the electromagnetic machines. And for diamagnetic machine, being an electromagnetic device, we have also a paraboloid lens. But the great difference is the, you can see later that the paraboloid lens create the shock wave outside the probe respect to the other device. These are different shape of the waves for electromagnetic, piezoelectric, and electrohydraulic machines, and they have the same aspect of the shock waves, the same shape for all the duration of the treatment. The difference from this for the CTU shock waves is the possibility to change the wavefront of the pressure, as you can see in these pictures, and also to change the shape of the duration of the shock waves. How diamagnetic shock waves retain the same aspect of a normal shock waves, as you can see in this image, with the characteristic of the possibility to have at 2 centimeters, that is the setting of the machine that we used for this measurement, at 2 centimeters of focus with a focal area of 2.14 centimeters square, a peak pressure of 42 MPa. The megapascals are is classified as a normal shockwave machine because as a respectable value of the maximum pressure. Then we have a negative pressure of 21, the pressure at the half of the values of the global pressure that is at -6 decibels area of 21 MPa, a negative pressure up to 6.8 megapascals to -1.7 MPa. This is very important because, as I said, for the importance of the ratio between the higher pressure and the lower pressure, we have a few values that is as the origin of the painless treatment that is unique for this machine. This means that negative phase of the shock waves, of our shock waves, is different as value respect to other machines, and so we have a lesser cavitational effect that is at the origin of pain during the treatment. The main features of these diamagnetic shock waves is the starting part that is the effect to a repulsive effect due to the diamagnetic effect. This is why that some materials, in accordance with their atomic structure, are repulsive to the magnetic fields. This property is related to the intensity of the magnetic fields. Higher is the magnetic fields, higher will be the repulsive or diamagnetic effect. We have also to consider that in this machine, the electromagnetic field is not a static magnetic field, but is a pulsed electromagnetic field. And this gives the possibility to have an alternating diamagnetic effects. And so we have the possibility to generate multiple shock waves. As you can see in this picture, we have a low frequency, high intensity pulsed electromagnetic fields. The intensity is very high, it's 2 Tesla, and is originated in this coil. It's an electromagnetic coil. All the energy of 2 Tesla is delivered in a lens, diamagnetic lens, that is made of a diamagnetic alloy. And this gives the possibility to realize a strong repulsive effect. And as I explained, this is a pulsed electromagnetic field. So we have an up and down movement of the lens. And this generates the mechanical shock waves, as explained. The possibility to focus this shock wave starts from a principle of optical physics, that is the Fresnel's principle. This principle states that a convex lens the segmentation of a convex lens in a flat lens did not change the optical property of the lens. If we apply the same concept to a parabolic lens that has the possibility to focalize the impulse, we have a flat lens with a certain number of rings that give the possibility to focus the energy at different depths. As you can see, the machine is provided from a series of lenses that gives the possibility to focalize from 2 centimeters up to 5 centimeters. But an interesting thing is that we can work also in a defocusing effect that is very important for a particular treatment that I can show you in specific picture. The ability to focalize is given at different depth with different dimension of the focus, and this shape is the characteristic of the non-focused shock waves impulse given from the flat lens. The software of the machine gives the possibility to change the main characteristic of the shock waves, the time of the rise of the shock waves, and the duration of the shock waves, so the amplitude. What this means that we have the possibility to have a more or less rapid shock waves when we are planning a treatment, but also the possibility to have the minimum or maximum amplitude of the shock waves that gives a different distribution of the energy inside the focus. Why this is important? Because we can adapt the treatment to the kind of problem for the patients, but also to the other aspect of the tissues that we have to treat. For example, if we would to treat a calcific tendinopathy of the shoulder, of a delayed union of fractures, we have the possibility to work with a rapid rise time to have suddenly the greater amount of the energy to the target. In inflammatory conditions in situations like tendon degeneration, we have to work in a more smooth way. And so we can modify the wavefront with a less rapid wavefront of the rise time, but also with the waveform of the shock waves and pulse, just to give a greater distribution of the energy inside the tendon. With the machine, we can modulate the power of the shock waves, but also the flow of the magnetic fields. So we have a greater effect on the lens. We have a different speed of movement of the lens, which emphasizes the effect of the power of the shock wave. So in this picture is explained the possibility to work on the flow of the magnetic fields and also the possibility to modulate independently the power of the shock waves. Another characteristic of these machines is the possibility to use for therapeutic effects also the magnetic fields. For example, in this picture, you can see that all the energy is discharged on the lens. This is the main effect of the magnetic fields when meet a diamagnetic material. The diamagnetic materials, in this case the lens, is impermeable to the magnetic fields, and we have all the energy here. And then we have the greater mechanical effect on the lens that generate the shock waves. In the interval between two pulses, the lens is not impermeable, but becomes permeable to the magnetic fields, and the vestigia, the residual magnetic fields, flow and reach in low values of magnetic fields to the tissue and work like a normal device for pulsed electromagnetic fields that you know in the market. The possibility to change the duration, the rise time of the shock waves and the duration of the shock waves gives the possibility, as explained before, the ratio between the energy of the intensity and the area of the focus, and gives different values of the energy flux density for area. As you can see, for example, if I set the machine at level 6 of power, changing the amplitude of the shock waves with the different varieties of stimulante, drenante, or disgregante, I can have different values of the energy in the focus without changing the power of the shock waves. And it gives a different possibility to treat the patients without modify the power of the pressure. This is the characteristic of our shock waves. And in the next slide, you can see the different transformation of the shock waves from the rise. That is a progressive rising of the variation of the pressure until the realization of the maximum values of the pressure inside the focus. And in summary, the possibility to work with these machines is due to possibility to work on 20 different levels of the energy to give the variation of the energy flux density from 0.08 to 0.5 millijoule per meter square. This gives the possibility to treat in different way all the common pathologies in musculoskeletal disorders, and the possibility to modulate the flow of the magnetic field during the treatment and the rise time. That is one of the main parameters of the efficacy of the shock waves. Now I will show you some clinical cases this is a post-traumatic bone marrow edema of the knee in a young sportsman with an osteochondritis. I treat these patients with these protocols, and the very, very interesting thing is that 45 days post-treatment, no pain, no bone marrow edema in the patients that returned to the sport activities. And usually, you know that bone marrow edema requires normally 6 months to spontaneous recovery, or with other machines in literature, we have from 3 to 6 months before the recovery of the patients. In this case, we had a successful treatment with 45 days post-treatment complete recovery. This is an emblematic case of a woman that was candidated for a prosthetic replacement of the ankle in a post-traumatic arthritis. We treated for 3 cycles of treatment because it was a very, very difficult case because the patient refused the surgical treatment. And with patients, for the patients and for the doctor, we treated the patient in more sessions and give the possibility to the patient to remain asymptomatic after 2 years, and she not underwent to surgical treatment. This is another emblematic case because the success of the treatment of non-union of long bones is greater between the 6th and 11th month from the trauma. In this case, we have 2 years from the trauma. Theoretically, is a patient candidate to surgical treatment, but I treat this patient with 3 sessions of Shockwave treatment, and the patients had a radiological and a clinical recovery over the time. In this case, if is the healing time of a non-union of the tibia 10 months after the trauma, in 45 days, the patients had the complete recovery of the fracture. That is unusual because we need at least 2 or 3 months to see this kind of callus of the fracture in a patient treated with the shock waves. And the same from this non-union, late union of the scaphoid bone that healed after 45 days from the treatment with the shock waves, with the CTU shock waves. We can use this machine also in difficult wounds, thanks to the unfocused lens. In this case, was a cutaneous necrosis post a total knee replacement. And we treated the patients 15 days after the surgery, and the patients healed in after 9 treatments, 1 treatment for weeks, treating only the parts of the knee all around the lesion. This is another difficult one, in the cutaneous necrosis after Achilles tendon repair. We treated the patients for 6 weeks, and we had the complete recovery of the patients. This is a very difficult cause because at the patients initially was proposed the amputation of the the leg because of an infection of the wounds after the surgery in a complex fracture of tibia and the peroneus. And here we can see the necrosis of the peroneus tendons. But in cooperation with the surgeon, with the colleague of plastic surgery, with the vacuum therapy, we reached these results at fasting the tendon that is now normal and the complete heal of the lesions after 9 months. It's very rare to observe in this short period a complete healing in this difficult situation. We can treat also easily some pathologies that like the trigger fingers. We give the possibility to the patients to avoid the surgical treatment with 18% of the patients completely healed using the little lens that is provided with the machines. And in the next time, I started to treat the arthrosis of the fingers thanks to the focus lens with good results. But most interesting thing that we can have a short treatment with 18 pulses for the treatment and the possibility to treat all the fingers that is impossible with the machines to contemporarily treat also the fingers and the different joint involved in the pathology. So I thank you for your attention, and now I'll explain the lens that I used in this situation. Okay. Okay. Okay, this is a classical lens. Okay, you can see the ring. The different number of rings give the possibility to focus the shock waves are different depth. Okay. And the functioning of the machine is due to this movement of the lens, the up and down, and the this is the focus lens, and you can experiment that I can treat a larger area and to treat in a short time the patients in a pathology that needs a treatment, different treatment for each joint. It's more rapid, the treatment, and it's also effective because we have the possibility to discharge the energy in a large area of 36 centimeters square. The diamagnetic effect now I would like to have your attention with your ear about this possibility to change the energy of the shock waves, changing the rise time of the shock waves. Okay?
Vuoi mettere un foglio sul sito?
Okay. Now we have the machine at higher level of the energy with a low rise time. This means that the start of the shock waves is not more rapid, but we are in medium, and you have a different it's more higher energy. The high but when you prove the machine, you have to understand the functioning with your ear rather than your eyes, because with the use of the machine, it's more easy to understand the kind of treatment that you are doing this moment. Now I change the flow of the magnetic fields, and the energy of the shock waves is the same. You can see that it's different. The movement of the lens is smooth. So I can modulate only the magnetic field and give a greater speed to the lens, because this is a greater diamagnetic effect and more mechanical energy to the lens. And this without varying the energy of the shock waves. So you can change the treatment with the standard setting of the machine about the shock waves, and to work with the other aspect of the shock wave. I think that this is very important because from the biological point of view, you give the possibility to stimulate different kind of cells, because in the tissues, not all the cells has the same response to the mechanical stimuli. Some cells are more reactive to the mechanical pulse, and other cells no, or a kind of cells need a certain type of mechanical impulse, and other cells need a different kind of mechanical impulse. So inside the tissue, you have different kind of cells, and you can treat with this modality, you can treat a greater number of cells. This is an explanation, more rationale for the possibility to treat the shock wave, the tissue without changing the power of the shock waves, rather the characteristic of the amplitude of the lifetime of the shock waves. Okay, you have questions?
Andras. Andras.
Yes.
Yes. So you have some questions. If not, I think Dr. Romeo will go on to treat the hand and my hand to show you. So.
Yeah. Okay.
You have a question?
From the theoretical part of the machine, because I know that it's not easy, because being different from the conventional machines needs to, for the operator, a change of parameters that are not usual for the conventional machine in the market. So it's okay from the theoretical point of view of the functioning of the machine. Okay, thank you. Okay, we start with treatment. Okay, I set the machine My setting will be of low energy of shock waves. Now we are up to 0.11 millijoule per meter square with the same value of the magnetic field. I treat with the stimulating part, with the stimulating aspect of the amplitude of the shock waves, that is a large shape of the shock waves, and with a medium front or rise time of the shock waves. We don't need a great values of the energy. Okay.
Assolutamente non è doloroso.
Now I'm touching directly the bone because the impulse of the shock waves reach the bone. We did the bone is superficial, no? Respect to the cutaneous.
And it's absolutely not painful. So
now I'll try with the higher values of the machine. Okay. Now I'm at the maximum of the shock wave of the magnetic field. We have different sound. Pain?
No pain, absolute no pain. So I feel it directly on the bone, and also I feel it, but it's not painful.
Yes, that's important thing that Thomas said, that as the sensation of the impulse inside the bone. That is the main aspect of treatment of the bone in general. The patients have to realize that the impulse is reaching the bone. We have at the maximum also of the shock waves. We have very, very great values of the energy now, of the magnetic fields and of
how
the
much energy is this now?
It's up to more than 0.30 millijoule. This is values of treatment that usually we use for the fractures, to stimulate the healing of the fractures. Now it's all at the maximum. It's high rise time, high values of the magnetic fields, and high values of the shock waves. And Thomas is still alive.
Yes, I'm alive. No, but now the sensation is different from before, but it's not painful. So I feel the like the explosion on the bone, but it's not painful.
And on my experience, this is another sensation of the patients. When I work with other kind of machine, normal electrohydraulic on electromagnetic machines, I ask to the patients, what are you feeling? I'm feeling like something of the point.
Like a needle.
Yes, like a needle, no? But with this machine, they said, it's an explosion inside my bone or inside my tendon. This is the characteristic of this shock wave that is different from the other. This is a treatment of the trigger finger. Usually the problem is at this level. We have an inflammation of the tendon, and the finger is blocked in the movement. With these machines, I have greater results. Okay, no, scusami. In treating the origin of the problem, we need up to 18 pulses for each treatment. So it's not a long treatment, but it's very, very effective in these patients. And with this length, we can easily treat only the part interested in the problem. Facciamo vedere un trattamento al gomito adesso. Gomito. Gomito. Now I will show you a normal length, okay, in the treatment of epicondylitis. Scusa, non dovresti spiegarlo un po'? No, spiegarlo un po'. This is at maximum level. Okay, così. It's the maximum energy of shock waves and magnetic fields.
So the sensation is like someone is pushing on my elbow, but it's not painful.
Anche se ne mette poca, si distribuisce, così evitiamo. Okay?
So I feel it's very powerful. So now it's the maximum power.
Yes, the maximum. I can work with, okay, the maximum of the shock waves now.
Yes, I feel it more powerful, but
More
it's also
powerful.
not painful.
I can try on yourself with this machine, so you better understand the functioning. Consider that that it's painful. You can treat yourself.
Okay. Okay, Andras, are there some other questions from your side?
Yes, if you can tell maybe something more also for orthopedic, so for knee treatment or some hamstring treatment, back pain or something.
I use these machines in great part of orthopedic treatment. I use also the machine in low back pain, treating with with this unfocused lens, I can treat the muscles. So it's very effective in treating the muscles. And I can work also, but it's for specialists, the facet of the joint between the two vertebrae, fourth and fifth vertebral lumbar. With the joint facet, with a good localization of the joint in not all the patients, because if the patient is fat, it's more difficult to treat the joint facets, but it's very useful as treatment. And then I treat all the normal common pathologies of tendon and of bone. Other questions for specific treatment?
Ask the others if they have some questions.
I asked them maybe to put the questions in the chat.
Okay, deal.
So from the technical point of view, the device now will be further developed. We are working also like on the CTU Mega 20 is ready, the new display, and also here soon we will get to the new display with the new PERISO software. So it's more intuitive, but you will see it in the next months. And so from my side, we are waiting for some questions.
I have one question.
Yes, please.
What about post-operating treatment? I know about meniscus operation.
We cannot hear you. It's the connection is very bad, so we hear you in the background. So it's.
Then that's the problem. I'll try to put the question in the chat, okay?
Can you understand him, Andras?
No, no. Sasha, write in message maybe. I hear you also very bad.
Contraindications.
Is the contraindication are the usual contraindication for other Shockwave machines, but now the contraindications is very, very few. For example, in disorder of the coagulation of the blood, and in pregnancy, and in treatment, for example, in the shoulder, in the patients, woman, treated for breast cancer, but immediately post the surgery. By the other hand, it's possible to treat the patients that have not active disease, reprisal of disease of the cancer. We can treat all the patients at a certain distance of time after the surgery for the breast cancer.
What about calcification of the shoulder and Achilles tendon, which is many times used with Shockwave?
Normally we use the standard of 3 treatments for each pathology of tendon particular. And about the shoulder, we use higher levels of the energy when we treat great calcification or great tensions. But you have to know that the main aspect of the treatment of the tendinopathy, calcific tendinopathy of the shoulder, is that you have to treat the tendon also, not only the calcification, because it's from the tendon that starts the healing process. And then you have to altern higher or medium energy. With the echographic pointing, you can choose the exact point of the calcification, but you know that you have to treat the other part of the tendon with medium, or also with low levels of the energy, because to have regenerative effect, you need not higher level of the energy. From Achilles tendon is quite different, because we have to consider if the problem is the mid portion of the tendon, of the insertional part with the calcification of the tendon. You need to treat with lower level of the energy the insertional tendinopathy, because you have a more inflammatory aspect, and you have to treat the patients with the first 3 3 sessions, then wait 2 or 3 months, and then another cycle of treatment. And the same as schedule of the treatment for the mid portion of the tendon. But it's important, in this case, you can treat medium or for a brief period higher level of the energy. But in both conditions, it's important to treat also the muscle to increase the performance of the tendon. And then you can use for the muscles the unfocused lens, and to treat the gastrocnemius muscle, the treatment is more effective.
Can athletes train immediately after shockwave tendon treatment? Possibility of tendon rupture?
No, usually we have, after the end of the treatment, 2 weeks of absence of training and other thing about the athletes. Then it's very important a period with specific exercise in eccentric load to better restore the tendon, and then after these 2 weeks, the patients will start the athletic activity more gradually.
How is this with the CTU omega 20 in this case? Training after treatment with CTU omega 20 for other pathologies?
2 weeks of training. But you have to know that in Achilles tendon in particular, and some papers from the literature say that is more effective the treatment of shock waves with eccentric load, and if the athlete continue the eccentric load for more time. Usually the treatment with eccentric load is up to 8 to 20 weeks to complete restore. But you have to know that in these patients, for Achilles tendinopathy, the treatment for the patient is necessary. Also, for example, 2 times in a year, because it's a problematic tendinopathy that is very different from the elbow and shoulder tendinopathy that are just near to be common respect to the Achilles tendinopathy that is related to many, many factors that we don't know completely what they are. And so it's important the no sport, no training during the treatment, then eccentric load training for 2 weeks, gradual reprise of the activity, and continue with the eccentric load during the activity.
Other question, Andras?
Okay, from my side.
So let's wait a few minutes if someone else has a question.
The Greek guys already have the device, or they are?
Yes, yes.
Okay.
About the shoulder, we can treat as usual the patients in the anterior part of the shoulder, but you have also to treat, to complete the treatment, also the posterior part of the shoulder, because many times the problem is of the infraspinatus tendon. And in general, when I treat many chronic patients with calcific or non-calcific tendinopathy of the shoulder, because there is a dysfunction of the upper quarter of the leg and of the arm, and then you can give the patients the possibility to the faster recovery if you treat the suprascapularis muscles with this lens.
Always the defocalized.
With this defocalized lens, as I explained for the Achilles tendon, is very, very useful to treat all this part.
And you combine this treatment, so you treat with the defocalized lens and then you treat with the focalized.
Yes, yes.
So this is very useful, so you have only to change the lens?
Yes, because it's important in this pathology not only to treat the calcific tendinopathy or non-calcific tendinopathy, because the effect of the dysfunction of the scapula and the thoracic joint. So if the patients don't recover the movement and the rhythm of this joint, you can treat the patients with shock waves, but you have not the same results that you can have with this machine treating contemporarily also the muscles, the posterior muscles of the scapula. Another example, in my clinical practice, I start plantar fasciitis in the foot, start with this to ameliorate the blood flow in the plantar fascia. And then after a session with the focalized machine, I treat the patients with the focus lens on the insertional part of the plantar fascia and the calcaneus. So we can have better biological treatment because we have the possibility to ameliorate the blood flow in the plantar fascia and then to treat specifically the point of the degeneration of the plantar fascia.
Okay, and you Andras, you tested your device in Slovenia, your CTU Shockwave. You did the first tests.
Yeah, but yesterday, but not in pathology, just on myself. So now, after this course, I will give to one colleague to test it for 10, 14 days and to get some response. So waiting for this, which is most important, the clinical result and fitness.
Okay, I will check now if here is Dr. Visconti online, but I think he has to work today also because he's working in the Brescia hospital, and he's at the moment is doing a clinical trial, and will in short time he will publish a study together with Dr. Romeo for the CTU Shockwave. So maybe also the next time he's possible that he's also present on a webinar.
Okay.
But my question, how was your personal feeling? Feel the device on your skin or on your bone? How was the personal feeling? It's
different than normal shockwave. So I'm just curious about the result. So the result is as I expect. It's great, but need to wait for the result. So yeah, the feeling is you feel, but it's different. So and also less shots than with a normal shock device. So I'm curious. Great.
But the low number of shots is due to the first the possibility to recharge the coil, to recharge it to Tislan in time, but are different. We have different way to explain the lower number of shots respect to other machines, because we have a double treatment with the main treatment is the shock waves. The adjunctive treatment is the residual magnetic fields. And then if you remember the shape of the hour shock waves in the plot that I showed to you, this progression of the energy invests a large area before to reach the focus. That is very different from other machines, where the shock waves in other machines is inside the probe, and you have the flow, the direct flow of energy in the focus is like a line. Without shock waves from the lens to the tissue, you have a starting point very, very short, because you have to imagine a very, very speed movement of the lens that you can see in when you prove the up and down of the lens. You have to consider that for the first part, we have a global energy that flow in the subcutaneous tissue, and then we have the formation inside the body of the shock waves, and you can energize a greater part of the body. So because it has a cone that inside the body go to the problematic area.
Okay, there are two other questions. So from Maria, she asked, can we use it on the neck for hernia on the neck, for example? For a hernia on the neck?
I never used it for the hernia of the neck. I think that it's possible to use the focus lens on the muscles, but directly on the lens, I think that it's very difficult, because you have to be sure that you are on the right, but you have to use a higher level of the energy to reach the depth of the hernia. It depends on the segment.
Okay, the next question is from Mr. Timothy. Greetings to Hong Kong.
Yes, thank you.
So he said, he tried treating a friend's shoulder yesterday, 3 centimeter focal length lens on pain spots, and then non-focal lens on surrounding areas. Look forward to this response in coming days. Does the diamagnetic effect change the energy density of the shockwave?
The pure diamagnetic effect changes more than the energy as energy flux density. I think that the diamagnetic effect is only an effect on the length that concerns the speed and the power of the mechanical pulse that generate the shock waves. And the 3 centimeter focal length lens, I think that it would be useful from a posterior access to the shoulder, because if you treat with 6 centimeters in the anterior aspect of the shoulder, you have a great possibility to treat the bone. So I think that it's better to work at 2 centimeters in the anterior aspect of the bone, of the shoulder.
Okay. Andras, from your side?
I'm okay. We're okay.
Let's wait a minute or two for other questions. Okay.
So, Tom.
Oh, it's another question from Shajo. Do you use CTU as individual treatment or in combination with canal techniques. Yeah, but Sergio, you are speaking about the CTU Mega 20, the CTU Shockwave. So let's wait for Sergio. So, okay, he's speaking for Shockwave. So I don't understand the question. Do you understand?
No, I think that it's better to work in a combination with other treatment, mainly rehabilitative treatment. In the literature, many papers states that is more effective the treatment of biophysical energy like shock waves and a correct training a period of treatment of the patients, because we have to consider for each pathology the effective causes and the muscular impairment. And
okay, excuse me, can you hear me now?
Yes.
Okay, it's much better because I have some stupid spell checks. I'm just asking, do you use the technique, actually the CPU, as an individual treatment or in combination with manual techniques?
Ma tu fai un trattamento manuale o fai solo la shockwave?
No, I don't. No, sorry, I don't work with manual treatments, and I use shockwaves for the treatment as a treatment, and then I think that it's better to the combination with rehabilitative treatment during and after the treatment. But I don't use manual treatment.
Thank you.
Okay, Timothy has another question. Does the diamagnetic effect alone have any therapeutic effect on the device?
I think that has a therapeutic effect due to a particularity of the shock waves, that we have to consider the shock waves act on cells, but the first target is the extracellular matrix, that is all the tissues surrounding the cells. And the correct stimulation of this extracellular matrix is more effective to stimulate the tensor. I think that this diamagnetic effect, that is a pure diamagnetic effect, gives this characteristic of a unique characteristic in efficacy of this machine, because in my opinion, we treat in a better way the matrix rather other kind of machines in the market.
Thomas, posso fare una domanda? Anzi, la posso fare direttamente al professor Romeo, poi magari traduci in inglese.
Sì, vai.
Buongiorno.
Spero che non sia stata già fatta questa domanda, perché ho seguito in inglese, però ovviamente ho fatto un po' di fatica fino a un certo punto. Le onde d'urto è noto che sono dolorose, le altre classiche, dolorose, perché colpendo il periosteo quando non c'è una patologia fa male. Se per dimostrazione o per errore di puntamento con queste diamagnetiche tratto il periosteo dove non c'è una patologia, possono creare problemi? Non sentendo il dolore, possono creare problemi?
Pietro, can you repeat the question in English and then answer in English, so also for the rest of the audience?
Okay, Domenico asked to me if this painful treatments can be dangerous from the bone, because if the patient has not the feedback of the pain, the operator can use higher level of the energy and the possibility to damage. You have to know that there is no possibility of damage with shock waves, because all the tissues that we treat are biological, so are live tissues and react to the mechanical shock waves. That is a pulsed effect. It's not a continuous effect that can damage the structure of the bone. And about the question, I say that the inconvenience that can be for the patients when we treat directly the bones, because we need to treat the bones of involuntary, can be a pain 2 or 3 days of the treatment, because this is due to overstimulation of the nerves of the periosteum. So the concept of the question of Domenico is good, but it's not a damage. Rather the possibility of a transitory period of pain that is resolving automatically, or with 1 day of anti-analgesic drugs.
Thank you for this good question, Domenico. So,
puoi sintetizzarmi velocemente la risposta, scusami?
Direttamente così?
Sì, in italiano, sintetizzando, vabbè.
Allora, tu puoi avere una sovrastimolazione del periosteo, ma non puoi danneggiarlo perché l'osso reagisce all'impulso meccanico perché è vitale. Se è un osso morto, come calcolo renale, lo distruggi. E quindi non succede niente. L'effetto che puoi avere invece è dalla sovrastimolazione del periosteo, e che il paziente possa dirti che ha avuto dolore, ma questo è normale, come con le altre apparecchiature.
Infatti, è proprio questo il discorso. Invece
Okay.
con la...
Ma solo dolore, non danno, tranquillo.
No, no, dolore, cioè,
non danno.
non avere il repere dolore potrebbe creare danno? No, ok.
okay,
No.
grazie. Okay, Timothy is writing now. What is your advice for doctors, therapists who are used with other shockwave technology, using the painful shock as guide to locate a lesion?
But I think the auto feedback of the patients could be useful for the treatment with other kind of device. For example, in plantar fasciitis, that is a complex pathology from the anatomopathological point of view. The auto feedback of the patients, as stated from literature, is useful. So we can work with precise focusing with the ultrasound examination, but in my experience, for the treatment of the plantar fasciitis, the auto feedback is very, very useful.
Lui dice, gli altri fanno un dolore, possiamo seguire il dolore, con la nostra tu non crei il dolore.
About our machine, but we have the possibility to treat, it's usual to treat many points in all the pathologies, but it depends from the site. For example, in the elbow, we have the precise point where the patients feel the pain when you visit the patients before the treatment, and then you can mark the points, and then you treat the points. And the same from the shoulder, and the same for the foot. But we have to know also the anatomy and the site of the lesion that is usual for that pathology. For example, for the shoulder, you have the calcification in the anterior aspect and the lateral aspect of the shoulder. So the painful assay guide is obviously for other kind of device. For this kind of machines, you treating different points as usual, you are sure that you are in the path. You can, yes or not, consider the pain as a guide for the treatment.
Okay, Andras, other?
Okay now. We just tried the device, yeah?
Okay, so I think from our side, we communicate everything, and also we give all the answers to the questions. If there are no other questions, we will thank the audience for their time. We will send invitation for the next time workshop.
Yeah, And we make more clinical for the next
Wait
time.
a second, there is another question from Konstantinos. So what is the most important advantage compared to the usual radial shockwave?
If you refer to the focus length, is the area of treatment that is larger rather for the radial shock wave. But you have to consider with the common radial shock waves is a rapid attenuation of the energy due to the aspect of the energy that is discharged mainly on the skin of the patients. With the focused length of the shock waves, you have a cylinder. Thank you, Thomas. A cylinder of the energy. This is the radial. And this the cone is the cylinder of energy that, yes, is attenuating, but don't discharge all the energy on the surface, on the skin surface, like for radial shock wave.
Yes. Thank you for the question, Konstantinos. Okay, let's wait another minute if there are some other questions. Thank you, Timothy. Best regards from Switzerland to Hong Kong. Thank you all. Okay, so then hopefully we see you again in a short time for another webinar. And we send all to you the best greetings from Switzerland.
Thank you very much for your attention and mainly for a very, very interesting question. Thank you for your question, really.